Myself Vignesh Vimal, and I am going to present a presentation on topic Symptomatic Voice Therapy, Voice Facilitation Techniques. Before arriving to my topic, I would like to share some tips to prevent COVID-19 transmission. So let's begin with the first one. We should wash our hand frequently with soap water, or we should sanitize our hand at regular interval. This will help us to prevent transmission of COVID-19. Second one, if you are having a feeling of cough or sneeze, then use tissue to cover your nose and mouth and dispose it immediately. If tissues are not available to you, then try to cough or sneeze into the elbow so that your hands do not get engaged in it. The fourth one, avoid public gathering and crowded place. Do not attend public functions or some meetings. The third one, avoid contact with others, such as by shaking hands, hugging each other, etc. It means that you should maintain a social distance. The fifth one, avoid touching your face, especially your eyes, nose, mouth, because it can cause transmission of coronavirus from your hand to your internal body. Let's see the sixth one. So we must clean those surfaces which are frequently being touched. The seventh one, we should avoid non-essential traveling, and if required then must use our personal vehicles. The eighth one, we should also call ahead before going to a clinic or hospital so that proper arrangement can be made there, or if the clinic is closed or hospital is closed, and we will get information from our phone and we will be saved from non-essential traveling. The ninth one should isolate himself or herself if they are feeling sick or showing symptoms of COVID-19 so that the spread of coronavirus can be avoided. The 10th one, we should mostly try to work from home. 11th one, always wear a mask if you are sick or if you are showing symptoms of COVID-19 or if you are going outside. So now let's come to our topic, that is symptomatic voice therapy, voice facilitation technique. Treatment options offer brief description of general and specific treatments for individuals with voice disorders. They are organized under two broad categories, that is physiologic voice therapy, such that those treatments that directly modify the physiology of the vocal mechanism, and symptomatic voice therapy, those treatments aimed at modifying deviant vocal symptoms or perceptual voice components using a variety of facilitating techniques. Treatment selection depends on the type and severity of the disorder and the communication need of the individual. Clinicians are sensitive to cultural, linguistic, and individual variables when selecting appropriate treatment approaches. In this video section, we are not going to touch physiological voice therapy, but we will be explaining symptomatic voice therapy techniques. The focus of symptomatic voice therapy is on the modification of the deviant vocal symptoms or perceptual voice components. Deviant symptoms may include pitch that is too high or low, voice that is too soft or loud, breathy phonation, or the use of hard glottal attack or glottal fry. Symptomatic voice therapy assumes voice improvement through direct symptom modification using a variety of voice facilitating techniques. So let's begin with the first technique, that is amplification. Amplification devices such as microphones can be used to amplify the voice in any situation that require increased volume, such that when speaking to large groups or during conversation when the individual voice is weak. As such, voice amplification can function as a supportive tool or as a means of augmentative communication. It can help prevent vocal hyperfunction as a result of talking at increased volume or for extended periods of time. Let's see the second one, that is auditory masking. Auditory masking is used in case of functional aphonia or dysphonia and often results in changed or normal phonation. Individuals are instructed to talk or read passages aloud while wearing headphones with masking noise input. Using a loud noise background, the individuals often produce voice at increased volume, that is called Lombard effect, that can be recorded and used later in treatment as a comparison. The third one is biofeedback. The basis of biofeedback is that self-control of physiologic functions is possible with continuous immediate information about internal bodily state. Biofeedback provides clear and reliable feedback in response to alteration in voice production, thus facilitating improvements in pitch, loudness, quality, and effort. It can be kinesthetic, auditory, or visual. Using biofeedback, individuals are trained to become aware of physical sensation with respect to respiration, body position, and vibratory sensation. Awareness helps the individual understand his or her physiological process when generating voice. Auditory feedback such as real-time amplification, auditory modeling is an effective way to achieve voice improvement. Now let's see the fourth one, that is chant speech. Chant speech is characterized by a rhythmic prosodic pattern that serve as a template for spoken utterances. It is used in therapy to help reduce phonatory effort that results in vocal fatigue and decrease in phonatory capabilities. Chant speech requires speech fluctuation and coordination among respiratory, phonatory, and resonance subsystems. Speakers habituate to these more efficient vocal patterns. The increased lung pressure required for these tasks may also decrease reliance on laryngeal resistance and reduce fatigue. Let's see a video to understand this therapy technique.
This tension that we're going to practice today is called chant talk. What's important here is that your voice isn't too high or too low, and you just keep it at a monotone, one range, not fluctuating. So using a comfortable monotone pitch, I want you to chant me, me. Now you try. Good. So just make sure it stays on one pitch and it's very easy coming out. So now we're going to do that 5 times. It'll sound like this. Me, 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 me. Now you try. Good. And when you do that, do you feel the vibrations in your nasal cavity? So it goes from your nasal cavity to your oral cavity. You can try it again as you speak.
Now we will see the fifth technique, that is confidential voice. Confidential voice is designed to reduce laryngeal tension or hyperfunction and increase airflow. The individual begins with an easy and breathy vocal quality and builds to normal voicing without decreasing airflow. This technique is intended to address excessive vocal tension and to facilitate relaxation in the muscles of the larynx. So let's see a video to understand this therapy technique.
Okay, so the type of vocal exercise we'll be doing today is called the confidential voice. It's a low volume, breathy voice. It's an easy voice. You can think of it as when you're producing the voice, imagine that there's somebody sleeping next to you and you don't want to wake them, but it's important to remember not to whisper. So we use this type of exercise to reduce volume and also slow down the rate of speech, and it also gives the vocal folds a break if they're being used harshly or abusively. So what I'm going to do is I will model the voice for you, just so you can kind of get an idea of what it sounds like. So this is a confidential voice. It's nice and low, slow, and breathy. Do you see the difference between that and normal speech?
Mm-hmm.
Yeah, okay. So what I'm going to have you do is just say a couple sentences. We're going to use the confidential voice, and I want you to talk to me a couple sentences about, you can introduce yourself and tell me what you did today.
Okay. My name is Alana. I went to work today. I was in the office at 9:30. The office closed at 7:30. And we were very busy. We saw lots of patients, and it was a busy, stressful day.
Good.
Now we will understand about glottal fry therapy technique. So glottal fry is useful for patients with vocal nodules and other problems associated with hyperfunction. For example, polyps, functional dysphonia, spasmodic dysphonia, vocal fold thickening and ventricular phonation. Because the vocal fold must be relaxed in order to produce glottal fry, this technique can be useful index of vocal fold relaxation. Although glottal fry is a powerful facilitative technique to offload tension in the larynx, it is not a long-term speech quality target. So let's see a video to understand this therapy technique.
Glottal fry or vocal fry is really the lowest vocal register that's produced. It's this aperiodic staccato sound that's formed by compression of the arytenoid cartilages or the vocal processes, which are at the back of the vocal folds, yet the vocal folds are maintained in a relatively loose position. There's very little airflow, then the voice becomes very sort of a popping or a creaking sound. It will sound such as or within speech it may sound, today is Tuesday. So the primary issue with vocal fry is really based upon the nature of the vocal fry, which is that there is, did you catch that? Vocal fry, where the nature of the voice change is related to insufficient airflow. So the goal with normalizing voice production or normalized voice quality is based upon sufficient airflow, periodic vibrations of the vocal folds, and then a forward resonance. So from a therapy standpoint, we would very much direct our efforts towards attending to the airflow, making sure they take a breath, make sure they check their posture, their shoulders and their chest are well stabilized, and that they're using sufficient airflow really from the beginning to the end of the sentence, as it occurs most often at the end of the sentence. So instead of saying, today is Tuesday, November 17th, you would say, today is Tuesday, November 17th, in an effort to sustain the airflow. When you sing, you keep the air moving as you sing, when you would never trail off. People tend to do that when they speak, so it's about reinforcing that consistent, steady airstream from the beginning to the end.
Let's try to understand the inhalation phonation technique. Inhalation phonation is a technique used to facilitate true vocal vibration in the presence of habitual ventricular fold phonation, functional aphonia, and muscle tension dysphonia. Individuals produce a high-pitched voice on inhalation. Upon inhalation voicing, the true vocal folds are in a stretched position, suddenly adducted and in vibration. Upon exhalation, patients try to achieve a nearly matched voice. This approach eases the way to gaining true vocal fold vibration. So now we will see two videos to understand this therapy technique and also to understand the physiology behind this therapy technique.
Hi Antonia. So you've been telling me that you've been having a hard time producing a voice and you're losing your voice a lot. So we're going to work on this technique called inhalation phonation, which will help you get your vocal cords into the position that they need to be to vibrate. So for today, I'm just going to explain the steps to you. There's 4 steps, and then we're just going to practice the first step. Now, this is also a technique I want you to know that we can only do in therapy. You can't take it out and do it while you're talking to people or at home or at work. So we're just practicing it here. So the first step is to make a sound. And as you're making the sound, you're going to bring your hands up on your inhale. So we're going to practice that today. Then the second step is to make that same sound, but on an exhale. So when we're working on those first 2 steps, you're using your hands as a visual cue. So you're going to bring your palms up for the inhale and your palms down for the exhale. The third step is to do both of those steps together, but without your hands. So you're going to make a sound while you're inhaling, and then make that same sound at the same pitch on your exhale. Now the fourth step is to do the same thing, but with a 1-syllable sound, a 1-syllable word, so such as cat. So you're going to inhale and say the word cat. Then you're also going to exhale and say the word cat. Now we'll know when this whole technique has been completed when you're able to say the word cat on your exhale. So you don't need that inhale as a cue to get ready for the exhaled sound cat. So we're gonna start the first step. So we're gonna inhale on just a high-pitched E sound. So like this. Can you try? Good.
Inhalation. And do a regular one.
Now we will understand about semi-occluded vocal tract SOVT exercises. Semi-occluded vocal tract SOVT exercises in voice therapy involve narrowing at any supraglottic point along the vocal tract in order to maximize interaction between vocal fold vibration, that is sound production, and the vocal tract, that is sound filter, and to produce resonant voice. Now let's see a video to understand this voice therapy technique.
So we just want to have steady airflow. Next, we want to turn on our voices while keeping the airflow steady. That equals keeping the bubbles nice and steady, never letting them stop. Let's try. Pick any pitch that is comfortable for you. Here we go.
Let's try to understand about straw phonation technique. Straw phonation is one of the most frequently used method to create semi-occlusion in the vocal tract. Narrowing the vocal tract increases air pressure above the vocal folds, keeping them slightly separated during phonation and reducing the impact collision force. To accomplish this, the individual semi-occludes the vocal tract by phonating through a straw or tube. Resistance can be manipulated by varying the length and diameter of the straw. Individual practice sustaining vowels, performing pitch glides, humming songs, and transitioning to the intonation and stress patterns of speech. Eventually, use of the straw is reduced and eliminated. So let's see a video to understand straw phonation technique.
We are going to do the very classic vocal warm-up exercise and use a straw. So now, the reason straws are so valuable is because they calibrate your airflow so that your vocal cords are getting an optimal level of air through them to create what's called full phonation. That's the fancy word for vibration that leads to a full voice. So here's how we use a straw. So what you're gonna do is hum into the straw and try to get a sort of buzzing sensation through the straw like this. You'll actually feel the walls of the straw vibrate. If you blow too hard or too soft, that won't happen. And that's your diagnostic that you've got an optimal amount of airflow flowing through the straw, which means you've probably also got an optimal amount of airflow going through your vocal cords, which means you're creating full phonation in a free, easy way. Essentially what the straw does is it makes your whole vocal tract a little bit longer. The tube that the sound has to go through is lengthened by the straw. So let's try a couple vocal exercises with this. You'll go, and actually I heard a little bit of extra air coming through, so let me do that again. Helps you know that you don't need to push so much air through your vocal cords. And you can keep going, so on and so forth like that, doing it.
Now we will try to understand about lip trill technique. Semi-occlusion at the level of the lips is accomplished via lip trills. This technique involves smooth movement of air through the oral cavity and over the lips, causing a vibration that is lip buzz, similar to blowing bubbles underwater. Often the trills are paired with phonation and pitch changes. The focus is to improve breath support and produce voicing without tension. So now we will see a video to understand this therapy technique.
Start by licking your lips and make sure that you relax all the muscles in your cheeks and in your lips. Place your ring fingers at the corners of your mouth and then press outwards and up to lift your cheeks. Now blow a steady stream of air through your lips to make them trill. Try to only blow as much air as you need so that you can keep the lip trill going for a long time. If your cheeks are filling with air, try pushing your cheeks more firmly against your teeth, using the entire length of your fingers to direct the air to your lips. Once you're able to keep the lip trill going, experiment with adding sounds like slides or different melodic patterns.
Now let us understand about posture. The patient is instructed in the technique of sitting with upright posture and with the shoulders in a low, relaxed position to facilitate voice production with less effort. Collaboration with a physical therapist or occupational therapist may be necessary with some patients. Now we will understand about relaxation. In case of vocal hyperfunction, a variety of relaxation techniques may be useful as a tool to reduce both whole body and laryngeal area tension. The goal of these techniques is to reduce effortful phonation. Frequently used techniques include progressive muscles relaxation, that is slowly tensing and the relaxing successive muscle groups, visualizing, that is forming mental image of a peaceful calming place or situation, and deep breathing exercises. Now let's try to understand about twang therapy. Twang therapy is used for individuals with hypophonic voice. It involves the narrowing of the airy epiglottic sphincter using a twang voice to create a high intensity voice quality while maintaining low vocal effort. The desired outcome is decreasing phonatory effort and increasing vocal efficiency. Let's try to understand this therapy technique by seeing a video.
So I'm going to show you a little demonstration now of how you can make that sound. So I'm going to say something with a twang. I also feel like I'm going to sneeze as well. So let me see if I can get rid of that sneeze. So here we are. The twang is this sort of bratty sound, spoilt child kind of sound, and it's this no, I want a pony, Daddy, I want a pony, or just to be not too gender specific, Mommy, Daddy, I want a pony or a skateboard. I don't care. I just want something. I'm really bored. You know, that really nasally sound. So if you can, a way to practice is literally just going And what's happening is that your soft palate is lowering and coming up to the back of your tongue. So the soft palate is lowering, and you're creating some space up there to allow that resonance here. And also the epilarynx is narrowing as well. So you're getting this quite tight here. There's a kind of a tight, that's pure twang is here. Can you hear that? Some people speak like that all the time. It's really, really annoying, isn't it? But can you see if you just add a little bit of that twang, so the way you speak, normally, if I was just to speak like that without any twang at all, then that would be the sound you're getting here. And that's fine, but people might not be able to hear that. And it's very, very chesty resonance, and it's mainly coming from the throat, although I'm really pushing the core muscles here as well to make a point. But what I want to do is just create a little bit of twang, not too much, but just a little bit. It doesn't have to be loud. Can you hear the difference? Now that's really nasally now. So, give that a go. That's the twang, and come up with a phrase. So the phrase could be something like, Nellie went to the market. Nellie went to the market to buy some nails. Nellie went to the market. Anything with na or ma or ng. So that again, that ng we talked about before. Getting that yeah. You can get a little bit higher with your sound, and you can start exploring the sound. So if you're on a call, just practicing presentation, an excerpt from presentation, give that a go.
Now we will try to understand about Yonsai. The facilitation technique uses the natural function of yawing and sighing to overcome symptoms of vocal hyperfunction. For example, elevated larynx and vocal constriction. The technique is intended to lower the position of the larynx and subsequently widen the supraglottal space in order to produce a more relaxed voice and encourage a more natural pitch. So now we will see a video to understand Yonsai.
Today we are going to demonstrate the Yonsai. I'm going to be the clinician.
And I will be the patient.
Okay, first I want us to just yawn. Just loosen up our neck and our jaw. Okay. Ready? Mm-hmm. Good job. Now we're going to do a yawn, and when we release the yawn, we're going to say ah. So it's going to be this. Okay. Good. And now we're going to do it where we say hi at the end of the yawn.
Okay.
Hi. Nice work.